So, so good afternoon, everyone, and welcome to our first event for AAPI History Month, presented by Asians United. Wait, what? What's Asians United? Um, Glad you asked. So, Asians United, and stand by. Let me actually pull up a quick slide. So Asians United is the connected community. It's an employee resource group that brings together Optum California team members with interest in the unique and diverse cultures that make up the Asian American, South Asian, and Asian Pacific Islander communities. Now, um, that sounds fancy, but how are we going to do a lot of the stuff that we want to do for our communities? We're actually aiming to do a lot of this by working with you, our team members, and our network of regional ambassadors to create awareness and give back to our communities. Yes, the ones that we actually live and work in. So, who actually is part of Asians United? I don't know how I got on there, but I'm going to give a high level intro and we'll actually jump into the panel because we'll share this later on in the recording. But Dr. Paul Choi from OC is actually our executive sponsor for the community. Dr. Yamamoto from San Gabriel is our clinician lead. My fellow partner in crime, Deborah King, is the operational lead, and I am the human capital lead for the group. So let's get this party started. First of all, we do want to thank all of y'all for joining and for everything that you do for our patients and fellow teammates. It goes without saying, it is truly appreciated. As I mentioned, I'm Ryan from Human Capital, or I believe going to be called the People Group soon. And I have the privilege to moderate today with my fellow partner in crime, Deborah King, who is the Director of Clinical Experience and Transformation. So our topic for today is, personal experiences as Asians in healthcare and how do we care for our AAPI patients. We have an awesome panel. So Deb, I'll hand it off to you to introduce our panel to us.
Thank you, Ryan. Can you hear me?
Yep, go ahead.
Yeah. Actually, just wanted to, can you go back 2 slides
Sure.
for folks who may not know the team? Oh, one more, please. Wanted to do a quick overview of who we are. Dr. Choi and Dr. Yamamoto are on the line, and they can introduce themselves, and I will jump straight ahead to me. As mentioned earlier, I'm the Senior Director of Clinical Experience and Transformation, and my why for getting involved is we all know as Asian Americans, the pandemic has fueled some unwanted behaviors and incorrect misconceptions of Asians. And I feel that right now is the most important and pertinent time to stand up and raise awareness so that we can bring about a culture and a nation of inclusivity, appreciation, and respect, partially for this generation and future generations to come. And did you want to do yours really quickly before we introduce our speakers?
I'll actually, Dr. Choi, Dr. Yamamoto, do you want to give a brief intro?
Yeah, I could do a quick intro. And so again, Paul Choi, I'm a regional CMO in Orange County. And for me, my why is I live in a very diverse community in Orange County, and we serve a very diverse patient population, as you'll hear during the panel. And so for me, I'm very passionate about serving our patients and delivering healthcare locally, and that's really delivering meeting the needs of the patient's language and culture. And so for me, that's what I'm very passionate about. And so you'll hear more about that. And I'll pass it over to Dr. Yamamoto.
Sure. I'm Thomas Yamamoto, and I'm an OBGYN in the San Gabriel area. I am practicing fully as an OB, so I do deliveries and surgeries and so forth. But I spent a lot of time actually in my earlier career in trying to make sure that Asians just in general have a voice, especially when it comes to healthcare. I started my career as a clinical social worker. I worked with a program called the Asian American Drug Abuse Program for about 3 years. After that, I sat on their board for about 10 years. I participated as a consultant. I sat on the board of the San Gabriel Medical Center across the street from my office for 6 years, all of which time I've done my best to try to promote a voice for our community. We work in San Gabriel Valley. It's, again, just like Dr. Choi said, it's a very diverse community Whereas in some parts of the area of our community, 50% of the population is Asian, mostly Vietnamese and Chinese, but like a sprinkling of Japanese Americans and other ethnics, Filipinos, as well as Indians. So we have a big challenge ahead of us because what I've observed is that we have a difficult time getting these patients into our office. And then once we get them in the office, the challenge is to meet their needs. So I think we're off to a good start with this program, and hopefully we'll be able to give you some information that'll be helpful.
Awesome. Thank you, Dr. Yamamoto. And just want to confirm, my why for getting involved is exactly like you guys mentioned. It is, we see our community, we want to do more for them. And while we can do so much centrally, I think we have to empower all our teammates and do right by them so they can actually, because they are the first people our patients and our communities interact with, the more we can empower them and provide the resources to them, they can actually do better in our communities that we work and live with. So I think we may have, I know we jumped back and I apologize for that. So Deb, I'll move it to our panel so we can actually go through and give a quick introduction and you can kind of walk us through who we have today.
Great. Yes, thank you, Ryan. It is my privilege to introduce our panelists this afternoon. We have Dr. Ann Pham, Chief Medical Officer of Legacy Healthcare Partners, Dr. Paul Choi, whom you just heard from. He is the Chief Medical Officer for Orange County, including Monarch and OCMG. Dr. Thomas Yamamoto, OBGYN from our San Gabriel Valley Clinic for our Legacy Healthcare Partners, and Dr. Kate Shea Maynard, who is our IPA Medical Director for the South Bay community.
Awesome. Thanks, Deb. Now, before we jump in, I was going to say, if you have any questions or queries, please feel free to throw them into the chat, and time permitting at the end, we will get to them, or we will definitely get responses and get back to share them with the rest of the group. So without further ado, let's get the show on the road. Dr. Pham, could you tell us a little about your background and your experience as an Asian in the healthcare field?
Hi, can you all hear me?
Yep.
Oh, great. Hey, thanks for having me here today. So I was born in Vietnam towards the end of the war, and I came over here to the U.S. Right at the fall of Saigon. We were one of those families that were evacuated by airplane and helicopter and boat over to initially a refugee camp in Guam. And we spent a few months there until we really were lucky to get a sponsor family in Illinois to take us in for a little while until we could get on our feet. Eventually, we moved to Missouri and then joined some other family in California, which is, how I ended up here back in the 70s. In terms of my healthcare journey, one of the reasons that I wanted to go into healthcare is because, I was just so grateful for having so much opportunity in the U.S. that I wanted to be able to give back to the community. One of the things that when I look back on what it was like to be a patient in the U.S. was that, my parents really had very little knowledge of how to navigate the healthcare system. So when I think about how often I went to see the doctor up until I was an adult, it's probably less than 2 or 3 times, because I think we just didn't know even how to access healthcare. Whenever we needed our immunizations, we ended up going to the local health department, mainly because the school nurse directed us there. But I think my parents didn't really know how to get a doctor and maybe didn't quite feel comfortable trying to find somebody. I think language barrier probably had a little bit to do with that as well. So, those are some of the things I think about as a PCP when I'm giving healthcare to my patients, especially the older immigrant population. They're really near and dear to my heart because they do remind me of my parents, and so it reminds me of the challenges that they had in trying to advocate for themselves, speak up for their own complaints when they have language barriers and just some general discomfort they may have in terms of just talking about themselves and asking questions. And so I think it's really important that we think about some of the culturally sensitive ways that we approach them.
an amazing story. Thank you, Dr. Pham. I had no idea about your story and coming to America and all of the difficulties and hardships that your family faced. That is incredibly powerful, and I would love to pick your brain a little bit more about it in the future. Thank you for sharing. Dr. Choi, turning it over to you, could you share a little bit about your background and experiences as an Asian American provider or clinician?
Absolutely, Deb. And when I knew I was going to follow Dr. Pham, I knew it was going to be tough. So I'm a second generation Korean American. I grew up in Queens, New York, and I grew up in a diverse neighborhood. I was fortunate to grow up with my extended family, as well as my grandparents who fled from North Korea during the war to create a better life for my parents and for us in America. When they came here, they did not have a support system, and so the neighboring friends and folks who supported them became my family. And so for me, one of the characteristics of AAPI culture, and one that I personally appreciate, is a sense of community and service to each other. And so this was especially modeled to me with the time that I spent with my grandparents, who had a large hand in raising me. So as I ventured outside of my community, continuing my education, the sense of community followed me. In college, I created one of our first AAPI clubs on campus, where one of the key areas was focusing on brand awareness, bringing awareness to our culture, and of course, as you read from my intro, sharing food and eating a lot of good Korean food. So fast forward, one of the reasons I went into medicine was to serve others. Our community emphasizes relationship and loyalty. Things are done collectively for the benefit of the whole community as opposed to individuality. And so that's really what shaped how I approach, my career as a physician, and I'm grateful to be part of a company that shares that sentiment. And so Optum is a company that embraces diversity and inclusion. Just by having this panel, just by having this moment for us to kind of share and share our stories, I think it is truly important. And so with that, the core values that this company believes in, relationship and service, is something that, I feel like I can embrace and do each and every day. So with that, I'll pass it over to you, Deb.
Wow, Dr. Chai, I think like Dr. Pham, I did not know your background as well. So that definitely was a surprise. And now I know who to call in case I'm hungry in the OC. So I will make a note of that. Dr. Yamamoto, switching over to you. Could you share your unique background and experiences in the healthcare field?
Sure. Well, I'm a Japanese American. I'm a third generation. So my grandparents came here as immigrants. My generation is called Sansei. San is number 3. My parents were Niseis, and my grandparents were Issei. My children are Yonsei. I think, when I think about my journey to medicine, which wasn't direct, like I said earlier, I started out as a social worker, clinical social worker. And my intention was to do the best I could to help individuals, not whole communities, but individuals. And it was frustrating because I realized, my gosh, there's only so much I can do with one person at a time. And then I realized that if I get more involved in communities, if I get more involved in activities such as serving on boards, serving as consultants and so forth, I can have a much greater impact. And this eventually led me to deciding to go into medicine. But I have to say that my journey did start somewhere in college, where I was responsible for a program called Asian Pride, where we educated children at the elementary level on Asian groups, just in general, and that kind of opened up my eyes to the richness of our community and the need to get education out there so that other people understand our community as well. But I tell you, I cannot be any more impressed by what Dr. Pham had to say. I think the Vietnamese community is incredible. They've actually come in one generation and acculturated incredibly quickly. Whereas my culture, my community actually took maybe 2 or 3 generations. We had to deal with issues such as, the inability to gain citizenship, the inability to own land, the inability to even intermarry. We relied on My grandparents actually relied on picture brides. Both of my grandparents were actually picture brides, meaning that they received photos of women from Japan. They looked at it, they looked at the background, and a decision was made whether they would be married or not. And then they would get married separately in Japan, and then the bride would come over and meet the groom for the very first time. This is an incredible situation. I think the Indian community has a very similar kind of tradition as well. But there was a lot of racism, a lot of institutionalized racism, xenophobia during the early part of the century. There still is, but a huge amount at that time. As you know, Japanese Americans actually were put into relocation camps or centers during World War II. The thought was that they needed to be protected and taken out of the community, but the real motivation behind it, I'm not sure will ever be completely revealed. Part of it was financially driven. A lot of it was fear and prejudice and hatred. But my parents, my grandparents, they ended up in these relocation camps, starting at Santa Anita Racetrack, right down the street from us. My father was actually at the Pomona Fairgrounds, and from there they took him to Wyoming, to a place called Hart Mountain. My mother was in Manzanar, which is just about 250 miles north of here, and was there for 4 years. The experiences in my community probably shaped, the way that I feel and think, and the way that I feel about myself. I think earlier on in my youth, I felt like I was inferior, like I had to be special in some ways that was not possible in this country. And it took me a long time, probably about 20 maybe years or longer in college, to actually discover, the power that we had, that our community actually has. But we have to reach it. We have to find that strength, and we have to find that energy and that talent. And, obviously Optum has a lot of talent from the AAPI community, a lot. Just here, you look at the individuals here who already have spoken, the intellect, the skill, and the talent that we have already. And it makes me very proud. As far as looking at the Asian community, and specifically the Japanese community, there are things that we have to work on. Culturally, there's a lot of self-help in our communities. I can't speak for all the other communities, but within the Japanese communities, there's a sense of the saying "shikata ganai," which means you can't help it, meaning that there's kind of like a sense of, well, you know what, something's going to happen, and you just can't, just let it go, let it take care of itself, be more spontaneous and stoic about it. And unfortunately, that's what I grew up with as well. There are other issues such as family decisions that are made, that an individual sitting in your office looking at you may not actually make a decision about their own life. They may actually have to go home and talk to family members, and maybe one of their adult children come back and actually make the decision for them. There are things like this that we have to contend with. There are biological changes or differences as well. Like Japanese Americans, for example, have a higher level of chronic hypertension in non-obese individuals, a higher risk of type 2 diabetes in non-obese individuals, a higher risk of colorectal cancer, a higher risk of stomach cancer. However, on the other hand, a lower risk of breast cancer, a lower risk of prostate cancer, relative to other Asian or mainstream communities. There's a higher risk of dementia. There's also more longevity. So you're going to see Japanese American seniors in your office because we live a long time. Japanese men have roughly about a greater than 40% chance of reaching 85 and older, which means that you're going to see super seniors in your office. And which means you're going to have to deal with the different cultures, the different, the means of different biology, make proper referrals, be able to communicate and bring those patients back into your office. So it does set up a major challenge, and I tell you, it sparks my interest, and I guess I'll leave it at that.
Thank you, Dr. Yamamoto. I apologize. I'm feeling a little overwhelmed because I hear all these stories from Dr. Pham. I was not expecting to do this, react this way, but Dr. Choi, Dr. Yamamoto, the story of your grandparents and how our parents and our grandparents have endured and suffered so much as Asians coming to this country, and the sacrifices that they've made. And I cannot help but just to say, I'm so grateful to be where I am today because of the sacrifices that our parents and our grandparents have made for us. And I just encourage each of us to pause today and really get to know each other, because we all have a story. And again, I apologize, this is not in the script at all. But, and just give our parents a call and say thank you. Our grandparents a call and say thank you for everything that they've done for us so that we can be where we are today. And thank you, Dr. Pham, Dr. Choi, Dr. Yamamoto, for sharing your stories. I don't think I can moderate anymore today.
We didn't mean to do that to you today.
Ryan will gladly moderate the rest of this, but
Yeah.
last but not least, Dr. Shay Maynard, the floor is yours.
Thanks, Deborah. And I think, we all feel what you're expressing, so nothing to be sorry about. It really helps celebrate our common thread. So my name is Kate Shay Maynard. I am a second-generation Chinese American who comes from a really strong family. My parents were grad students, immigrant grad students when I was born. And as you all know about grad school, they had no resources. So I actually was born in Taiwan, where my grandparents lived. And that was a fortunate thing for me because I got to go and be with my family very often during the time of their education. The one thing I really learned and try to carry with me now in practice is that despite the educational background of some immigrant patients, they may not understand the need for healthcare. So I know for my parents, oftentimes they were entrepreneurs. They also worked for corporations. And even when they had healthcare, and often we didn't have healthcare insurance, they didn't access healthcare, just like Dr. Pham was talking about. So I grew up also with little preventive care, no dental care, and that has really made an impact on the overall health of my family, of my parents. So it's a lot of catch up we've had to do as the next generations have come on board and learned more about what we have available to us in the community. So when I started med school here in Southern California, one of the things I really wanted to do was help our community. And luckily for me, where I went to med school is very close to the San Gabriel Valley. I also did my residency there. And while I was going through training, I was able to volunteer at this great Buddhist community clinic that really aimed to bring education and healthcare to those in the AAPI community who lacked it the most. And I could see from the very beginning how difficult it was, understanding just a basic new patient questionnaire. We've all experienced that with our patients. How many languages is that available in? And even with translation, does it really make sense to our patients? So that's when I really came to better understand, how much need there was in our community when it came to healthcare. The other benefit of being someone in my background, with my background culturally, was I come from a really, really tight-knit family on both sides. And one thing you learn, and all of you could probably attest to this in an Asian family, is one of the most important things to show to one another is respect, especially to our seniors. And that's something I really carry through practice now. I feel very fortunate. I practice in the South Bay, and everyone is more aware of the Asian American AAPI community in San Gabriel Valley and in Orange County. But here in the South Bay, we actually have a large population of patients from this background as well. And, I'm fortunate with that because I actually get to practice and take care of patients from similar backgrounds. And I think the show of respect is so important all the way through. In Chinese language, as in many languages, you have different types of pronouns that you use to show more respect. And I always start with that, especially with my senior Chinese patients, because I can use my language background too. And I love the connection that's built with my patients when I'm able to do that. And I think what it shows them is not only am I showing them respect, but that I understand some of their background. We have a common thread, and we have a great starting place for our conversation, and that I see that. And I think that's what we all want, is for our clinicians to see us and who we are, and our cultural background is such an important part of that.
Dr. Shea, that was amazing. And I just want to say, Dr. Pham, Dr. Choi, Dr. Yamamoto, Dr. Shea, everything you said, I think it hits home because family truly is like our center. I want to say it's our pillar of strength for most of us. Before we change gears into how we actually care for our patients, I'm going to put a shameless plug that Mother's Day is on Sunday. So to Deborah's point, call your mom, call someone else's mom, call any mom you know. Hell, call your dad also. As a dad, I'd be like, yeah, someone give me a call for Mother's Day. I'll be happy. But switching gears, Dr. Pham, I'm going to kind of jump into a little more of what we said around like taking care of our Asian patients. And this may not be highlighted, but that's what I wanted to see. Like, what are the special considerations and, nuances that may be there that sometimes we just take for granted or we don't even have visibility to?
I mean, that's a great question, Ryan. And I'll just touch upon one aspect that I think about when I'm talking to my immigrant patients, particularly. When we look across the board, Asians in this country have the same rate of depression and anxiety as the general population. And yet it's a population that seeks mental health care at a much lower rate. And I think there's a couple of factors for that. One is that I think as a survival mechanism, there's a lot of stoicism in the cultures. And so they're reluctant to kind of talk about past trauma. I mean, if you think about a lot of the immigrant populations in the older generations, they've gone through, political persecution, war, poverty before they came here. And so I think they try to maybe move on or survive in this country by not really addressing those issues. But I also think there's probably some stigma in terms of seeking out mental health care just in the cultures in general. So I try to think about that when I'm with my patients, and I'll ask them a little bit about their life story. And inevitably, they'll bring up some of those things, but they won't bring it up in a way of like, this is hard for me to deal with. This is, something that I struggle with. They don't necessarily bring it that way. They just sort of bring up these things as a matter of fact. I remember talking to one Cambodian patient, and I was talking about her, asking her about her family history. She goes, I don't know my parents' history because, they were part of the killing fields. So, those are the types of things that, like, I think they're really important to address, but like in a very gentle way. And it sometimes takes a little time and prodding for that. So, so when I think about that, I think of like mental health and behavioral health. And I'll save other stories for the other panelists.
And Dr. Pham, it's funny you mentioned that because I think it is known, like, we are, I wouldn't say secretive, but like you said, we are sensitive, but secretive. We always have our guards up until we have like this bond of trust before we open up. So no, I think we can definitely relate. And Dr. Choi, kind of pivoting deep, like Dr. Pham, I think she shared one story. I'm sure you have a couple more in the same way, but when you deal with Asian populations, what do you see that, may literally not come, or it's not known to everyone in the medical field, for lack of better words?
Yeah, no, thanks, Ryan. So for me, and I said this earlier, but I truly believe, delivering, care is local, and we have to meet the needs of the population, and especially ensuring that we have the language and the cultural needs. And, especially in Orange County, where, 25% of the population is AAPI, how to be mindful about that. And that represents a large proportion of our patients that we serve. And so for me, I'd like to share two examples, one professionally and then one personally. And as a pain management physician, what's always top of mind for me is how culture and background can impact how a patient, not only responds to pain, but how they express it, right? And so, in my culture, you don't express pain and you don't ask for, medications. And so sometimes pain is actually undertreated. And so, for me, the way I approach it is making sure that I ask the appropriate question, knowing the sensitivities and being mindful of where the patient's coming from. And, that's really allowed me to provide that tailored care to the patient, not just thinking about their medical conditions or what is their medical diagnosis, but also thinking about their background and the cultural and where they came from, because that really allows me to provide that tailored, better care. And so that's one example of my experience as a physician delivering care. But then I'd also like to share a personal story, and this is really a personal story that also intersects with my role as an administrator here in Orange County. And so this is very close to home. It's my mother-in-law, who's 30 years living in the community in North Orange County. And so as she's been getting older, she's been getting a lot more healthcare needs and complications. And so for her, she was having trouble as she was seeking specialty care and coordination of care because of some of the language challenges of that. And so, not only did she express a lot of this to me, but I was able to eventually bring her over to Optum, so I hit my growth metric on that one. And so she joined one of our clinics in North Orange County, which was a, very heavily Korean-speaking clinic, which I'm very proud that we tucked in several years ago. And over the years, we've been really trying to meet the needs of that patient population by building a network of Korean-speaking, not only physicians, but offices that could also help coordinate that care. And so, to me, that speaks to Optum not only embracing that, but the leadership allowing us to kind of create a network that really values that one-on-one patient care. And so for me, just very fortunate and honored to be a part of that. The other thing I'd like to say is, again, as I shared the story with as I did with my mother-in-law, I want to say to kind of all of you is that similar to what I just expressed, I'm sure you guys have all of these stories. And so as we think about AAPI, not only for this month, but how do we keep this going and how do we keep the momentum going? And so again, just really honored to be a part of this panel and part of this discussion. So thank you.
Thank you, Dr. Choi. And I know we jokingly say like we don't like our mother-in-laws, but you have definitely proven that wrong, because I don't think that's true in the AAPI community, but there are pockets of it. We just have a funny way of showing we love them. Dr. Yamamoto, I know, switching to you, I'm sure you have a fun story, and like you said, you definitely have a wide population that you kind of cater to also in San Gabriel. What do you see that we should be mindful of, especially when it comes to the Asian population?
Well, like Dr. Choi, I have to confess I also have a mother-in-law story, but I'll save that for a little bit later. I think that as I was in college, learning about my own community and learning about my own roots, we were known as the Asian community was known as the silent minority at that time. Since then, we've become a little bit less silent, but probably not as verbal and not as out there as maybe some other communities. So that kind of works against us in a way. And so I think it's important for us as speakers to be able to reach out and to inform other people, other communities, not just the mainstream communities, but also other minority communities in awareness of what's going on in our community. So be that as it may, I think one thing that I've always noticed about my Asian patients, and most of my Asian patients are of Chinese descent. They do pretty well with English, but sometimes have to come in with a translator because we don't unfortunately have a Mandarin translator in our office. We don't have a Vietnamese speaker. So unfortunately, we're a bit limited in how we can communicate with our Asian patients that don't speak English. That can be a major challenge from the beginning. So I mean, in going forward, there could be some thought maybe put into how we can maybe overcome that. Bring in some staff that have language capabilities that are needed in this community. The other thing is I notice is that as I sit in front of an Asian-speaking patient, it's really tempting for me to maybe speak a little bit louder, to speak slower, louder, a different sort of cadence, and it's just kind of a natural inclination for me to do that. Over the years, I found that that's not necessary. It may be actually somewhat insulting and off-putting to that person. The most important thing is to keep in mind that the whole idea of respect and dignity, especially in the AAPI community, other communities as well. I'm not saying that we have complete ownership over that particular quality, but extremely important to keep that in mind, that even though we believe that a patient may not be understanding or hearing us, that that they are taking in quite a bit. The other notion is that quite often they will not tell us everything that we need to know about their disease process, about their whatever problem they've come in to see us for, and that it may be a little bit more challenging in dealing with certain chronic conditions. So be mindful of that, be sensitive to it. The community that I work in, San Gabriel Valley, there are other groups that are actually vying for the Asian community, and probably doing a slightly better job than we've been doing in recent years. And so I think over time we can probably give a little bit more feedback, insight into maybe how we can better serve this population. Maybe not just language, not just culturally, not just branding ourselves in a way that is a little bit more receptive, but tailoring our clinics, our offices, our frontline staff, our our teammates, and educating them on how to maybe be a little bit more sensitive to the different issues of the AAPI community. But putting that aside, which I think we're all aware of for the most part, I have been dealing with some personal issues. My mother-in-law has been fighting pancreatic cancer now for about 5 years now. Surprisingly, it's an incredible story and journey, but she was diagnosed about 5 years ago and underwent chemotherapy and other terrible kind of treatments that were really difficult for her. She managed to get through that and decided recently that she was no longer going to have any sort of treatment. She refused to go to the hospital at times, and she eventually refused to go to a skilled nursing facility and so forth. And she fought this. She fought my wife vehemently. I mean, she would scream and yell, and she would fight and scream and yell at my father-in-law. And we'd finally get to the hospital, and the nurse would walk in, and then she'd turn sweet. She'd totally turn all that off. And she'd put on this smile and this face of, oh, okay, so happy, and I'm happy to be here, and thank you. And then the nurse would leave, and she'd get back to the, to the argumentative sort of kind of personality. And it's something that we've had to deal with for now, 5 years, and she's now in a nursing home out here in San Gabriel called Mission Care, and again, I'm hoping that we can actually facilitate her needs, get her through all this, and possibly even get her home for a while before things maybe take a turn for the worse in the future. But I have to say that it has culturally been a challenge. It's been familially a challenge, and as an Asian American, third generation, being somewhat removed from the immigrant populations of first generation or second generation, it's been eye-opening to be able to see this personally and to actually go through that journey with it. But as Ryan said, we in the Asian community, maybe we get along with our in-laws a little bit better. I may be wrong about that, but I do love my mother-in-law, and I hope for the best.
Dr. Yamamoto, she sounds like a fighter. So
She is.
yes, uh, I know this may be an Asian thing, but yes, we our prayers will be for her, and yes, she will be a fighter. She'll be stuck with you for a while, so I don't think that time is coming soon. But no, I do want to thank you because and all our panels, before I actually give Dr. Shaya a chance also, is this is not on script, all this, and I do want to appreciate you being vulnerable, because it's stories like these that make us relate. Like, it's not just us, this actually happens as the whole community, and so this actually brings us together. So, and a lot of the things that you mentioned, especially like the language and like how do we actually serve our seniors or super seniors, like you said, how do we actually relate to them, especially like on the language or like even the media that we can use to show the services we offer. I think those are some of the items we do want to take as this group. We do want to address with the resources and groups we have within Optum and see how we can better serve the communities. So apologies for kind of going off track, but Dr. Shai, I will hand it to you because I know you've got a diverse population of patients that you adhere to also, and they definitely have their fun stories.
Thanks, Ryan. One thing I'll say about a lot of patients in the AAPI community, especially for my own family, there's definitely a lot of privacy around their diagnoses. And there's also some embarrassment, I'll call it, and kind of some touching on what Dr. Pham talked about with mental health issues. That's definitely even stronger. So I think one thing to remember when we are working with these patients is that sometimes you really have to dig out the answers that you need. And in one particular area, I think a lot of us who have an AAPI background or work with patients from this background know about is traditional medicines or traditional therapies. And I'll be the first to say that a lot of these therapies are effective. But some of them interact with medications we might be prescribing, or they can cause side effects, just like our medications can cause side effects. So I really encourage all of us to be very gentle, yet straightforward with our questions to our patients about, what other supplements or treatments might you be taking at home? Are there any herbs that you take? Do you see any other types of medical professional, healthcare professionals? And that might bring a lot of information that we need. I'll tell a personal story about this. My grandmother, whom we celebrated last month, her 99th birthday, she has always been, quite the poster child of health until she hit 90. And that journey started about that time when she ended up at the emergency room with a syncopal episode. And they dug and dug, and they couldn't find anything initially. So then we went through her medicines, and my grandma stands by this one Chinese herb called bai yao, which loosely translated means white powder. I'll put it that way. But my grandma would take this for headache, and it would work. She would also take it for joint pain, GERD, and just general malaise. So we weren't really sure what that was. And I was at medical school at the time. So I started looking through, what is it that she could be taking? And so bai yao, from my, quick research, showed that, it can help serve as an analgesic. But one of the side effects was actually leukopenia, which she actually was found to have in the hospital. So my first message is that we need to look into all these treatments that our patients may be utilizing, because it will help us in their diagnosis and to watch for any, contraindications or conflicts with their other treatments. The second thing is that I learned is not to let it blind us, because in the end, she was diagnosed eventually with paroxysmal atrial fibrillation, then AFib, and then sick sinus. So, you still have to treat the whole person, and you don't want to cut short any of the evaluation you would have done for that patient. But just keep in mind all those cultural nuances, and keep in mind that you may not be the only healthcare provider or the most important healthcare provider in their mind, in your patient's mind. So I always think about that now when I treat my patients or I meet patients from AAPI background for the first time. And the second thing that I wanted to talk about was the importance of family. And it doesn't have to be versus autonomy. When I was in training, I was at County Hospital, and there was a patient who actually had recently emigrated from mainland China. And she was being treated for an aggressive advanced malignancy. And she was probably in her early 80s. And her son told me, don't tell her anything about her diagnosis. She has gotten chemotherapy in China, but we've never told her. Please don't talk to her about it. And so here you're stuck, in American training, we're all about patient rights. And so how do I approach this? And so, it took some time to get to know the patient, but through my conversations that day, I asked her, how much do you want me to share with you about your diagnosis? And of the things you don't want me to share with you, whom do you want me to share this with and how much? And that's kind of how we started the conversation. And she actually did, in fact, not want to know her diagnosis or treatment, just kind of be prepared for what the next step is. Whereas she wanted her family, us to defer to her family for most of that. And that worked for that patient. But as I'm working more in the outpatient world in the South Bay, I don't see that as often, but I see a lot of family interaction. And I say thank goodness for that. If we could all have family members who help take care of us that much, that's great. But I think this is a fine line that as clinicians, we all have to walk. We need to very much so be compliant and respect our patients' wishes. And if they don't want us to talk to their family, we don't talk to their family. But if they do want us to, we still have them, make sure they give us their consent for the level of communication, but that we respect that wish.
Agreed. Dr. Shai, thank you. I think like we, in all through the discussion, I think respect and sensitivity is definitely, but the fact you mentioned about the herbs, I'm sure, all of us have a little grandma's, basically the little thing that helps keep you, whether it's a common cough or a cold and stuff, but we just don't understand like how those could actually impact any other medication we could be taking. So thank you for highlighting that. That's what I was like, yeah, I may have taken one of those too. I know we're almost close to the top of the hour, so I do want to thank everyone, Dr. Pham, Dr. Choi, Dr. Yamamoto, and Dr. Shai. Thank you. I know I think we took away from your lunchtime, but this was truly, and I think Deb will definitely confirm, I think this definitely confirms like, in the AAPI community, what we experience and what we relate to. And by hearing this, it is definitely, it helps us create the awareness that, yes, this is happening and we are working to address some of these, and we are proactively, like you said, the fact that we are working to address these and not dance around the topic, but these are things that should be on our radar, and how can we better it for our patient population? This just reinforces those facts. So I do want to thank you. I also want to thank everyone who has attended. Like I said, it is lunchtime, so I do apologize. This was the best time for us. Before I let you go, that's what I will open it up. Dr. Pham, Dr. Choi, Dr. Yamamoto, and Dr. Shai, if you have any last comments, feel free to share, because this was amazing.
I think I just want to say one thing, Ryan, about the pandemic and how Asians have experienced the pandemic maybe slightly culturally different from other groups. In looking at that, what we've seen over the previous 2 years, that hate crimes against Asians have doubled over the past, since 2019. And I've seen some of this, close up front, that the pandemic, as it in a certain way, kind of been blamed on the Asian community. A friend of mine who is very active in the COVID-19 AAPI project kind of put it this way, that that as Asians, we're all Chinese. You know, we're all Chinese. We're looked at that way, and it has been a little bit more rough for us, and especially on Asian Asian females, I think have been more targeted than males. So this is kind of something I wanted to say and put out there. A lot of that has kind of cooled off since then, but I think the special struggles that our community has had during this pandemic should be known and put out there as well.
Dr. Yamamoto, thank you for flagging that. And that is exactly why this is called an employee resource group. But what we're going to do is we are actually going to work with UHG and Optum to see what are the resources that we can provide. So I will come back if there are more comments, but I did want to put this next screen up. This is essentially to join the connected community that is there. We are there on the intranet site as well, but what we're hoping to do, as the month goes on, and not just for this month, but as the year goes on, is we want to see how we can provide more resources to our team members exactly to address some of the issues that may be happening. Give them the right platform. Who can they reach out to if they have questions, concerns, and if they just need help? How can we actually help our teammates? Because like we mentioned, we know stuff is happening. We want to make sure that as a company, we can actually provide for our teammates. And so that's what we want to make sure, like we can provide the right platform and give them the resources to get through all this. So I'll take a pause there again for any more questions before I close it out. And anything else from our panel, it'll be awesome to hear.
Ryan and Deborah, I just wanted to say thank you for hosting this panel today. For me, it was just really nice to connect with everybody and hear about your family stories. They certainly resonated with how I see my family and how I take care of my family as well. Thank you so much to everyone who participated, and I hope that we all connect together and share our common stories. Thank you.
Awesome. Thank you, everyone. Have a great rest of your day. Stay safe. And not to sound corny, but it is Asians United, so stay united. Thank you. Bye.
Thank you, Ryan and Deborah.
Thank you.
Thank you.